Hello, everyone who is joining us for this webinar series from Hexacon. This is our second webinar in the series, but the first one for this year. So we are welcoming you up for this as we're waiting for others to join. Please enjoy yourself with this short interlude of music. We should be starting in a moment. Okay, everyone, welcome once more for this particular webinar, and we are excited to have you around, and we will be able to have quite an interesting 1 hour, 30 minutes, about 90 minutes of discussions about matters adolescent sexual reproductive health. And we are excited to have you join us, and we hope that we are going to have a very exciting discussion. So, let me just put my camera on so that you're able to see the person you are talking to. So my name is George Capillo. I work for Amref Health Africa as FPRH Technical Officer and supporting Knowledge Success Project that is working closely with Hexacon. So we are happy to be here to be with you so that we are able to execute this webinar together and understand more, get more in depth into issues adolescent sexual reproductive health and learn more across our region. Thank you so much. So without wasting much time, I would be able to just quickly delve deeper into the webinar norms of today. As go into this discussion proper, we hope to have following norms that we try as much as possible to align to. For example, number one, we hope that we respect your time and availability. We don't take it for granted that you've been able to join us to discuss this discourse. We also, all attendees are requested to be on mute. If you wish to ask a question live, please raise your hand and the moderator will be able to unmute your microphone. Please let us make good use of the chat box that we have. So type your questions and comments in the key question and answer box so that we are able to have a very engaging and interesting webinar. Again, we are going to have a 90-minute session. So we request all of you to observe allocated time during session. Let's be respectful of each other's opinions. We are all knowers and keepers of information, ASRH, and we hope that will be able to be observed during this webinar. To spread this message further across, we are using hashtag. The hashtag we are using today is strengthening ASRH systems. The hashtag we are using today and popularizing today and tomorrow is strengthening ASRH systems. So please help us spread the hashtag so that we have as many people as possible to be engaged in this discourse on matters ASRH. For the agenda, we will have opening remarks that will be done by Hexacon, and then our moderator will be able to take it over to be able to now take us through the webinar objectives. Our moderator will also give us the more information about the panelists that we are having, and then the moderator will be able to guide us through panel discussion and panel presentations, and then we'll welcome the floor for question and answers. There'll be a parting shot, and then also we just want to know how we can improve other series of webinars that we are having or planning with Hexacon. So we'll urge you that you stay and participate on the live poll that we'll be able to have at the end of the webinar. So without further ado, I would want to just get to know more about things that you'd want to do here. For example, the poll that we are having now is just look at number one. It's talking like, it's saying, please let us know the country you are joining us from. Please type the country that you are joining us from. And then please also let us know the role that you play in ASRH system strengthening. Are you doing clinical services? Are you advocating for policies and awareness? Are you in research? Are you in funding for ASRH programs? So we would just want to know that. So please just type that. We want to know which country you are joining us from. We want to know which role are you playing in ASRH system strengthening. So we give you about 3, 4, 5 minutes to be able to do that. I know we are quite a number, so we should be done by 2, 3 minutes from now. So please, if you're joining us now, we want to know which country you are joining us from. We would also want to know which role are you playing in ASRH system strengthening? For example, are you a clinical service provider? Do you advocate for policies and awareness, or maybe around service delivery? Are you in the research field on matters ASRH, or are you in the funding bit of ASRH programs? So we want to know that. If you're joining us now, please kindly provide us with that information. So if you're joining us now, we are asking to know where you're joining us from, which country. We'd be glad if you give us the name of the country you're joining us from. And then we're also keen on knowing which role you're playing in ASRH system strengthening. For example, are you a clinical service provider? Are you in the service delivery, advocating for policy and awareness? Are you in research, or are you in the area of funding for ASRH programs? All right. I think we've done close to around 5 minutes of that, so we can move to the next bit. So allow me to introduce our moderator. Allow me to introduce our moderator. Our moderator for today is Freddy Komia. Freddy Komia is a Kenya registered nurse working for the government of Kenya, Ministry of Health. Fred is based at Ministry of Health headquarters, Happy House in Nairobi, and is currently supporting health sector legislations, regulations, and policies. Fred is an SHRH enthusiast and advocate, an active member of professional associations, many. One of them, National Nurses Association of Kenya, NAC, where he served previously as the National Secretary. He is also a member of East Africa, Central and Southern Africa College of Nursing and Midwifery, Hexacon. He is also the immediate past county national representative CRN for Hexacon for Kenya, and is currently the chairperson of Hexacon Kenya chapter. So Fred, welcome, and take us through the remaining bits of this webinar. Thank you so much.
Many thanks, George, and thank you for that very elaborate introduction. Good afternoon, colleagues, ladies and gentlemen, from wherever you have signed up. To some of you, it is morning. Some of us, it is good afternoon. As George has said, this is going to be a very engaging deliberation around adolescent, youth, and reproductive health, which we would want to hear views from the experts. We have a panel of 3 experts who I will be introducing shortly after this. And I believe it's going to be a very fruitful engagement. Please observe the norms which George has shared, our mics to be muted. And we'll have a session of question and answer after the panelists have done their presentation. So before we go any further, it's always good to have the blessings of the gatekeeper. And I would want to call upon Vice President of Hexacom, Madam Evelyn Maziku. If you can hear me, we would like to ask you to give your welcoming remarks, after which then I'll be able to do the webinar objective. Madam Evelyn.
Thank you, Fred. Thank you, everyone. I'm definitely not Evelyn Maziku. She's gone to She's gone to the field, so she's not able to stay to the end. But let me take this opportunity to welcome everyone to this webinar. This is so important to us, being the second of the series on ASRH. And we want to thank Amref for organizing this webinar, and particularly for bringing such talented experts to speak to us this afternoon. We welcome everyone who has come, and we hope that it will be a good learning experience for all of us, and that at the end we'll be able to use whatever we have learned to make a difference in our sexual reproductive health services in our respective countries. So far, we have 11 countries of Botswana, Malawi, Kenya, Seychelles, Zimbabwe, Mali, Mauritius, Namibia, Tanzania, South Sudan, and Zambia. I'm sure many more are joining, and maybe there are some that I've not seen. So continue chatting with me so that I know where you are coming from. For those who don't know me, and I believe there are very few, my name is Elizabeth Oyuer. I'm the registrar for Hexacon. Thank you so much and welcome everyone. Good afternoon.
Good afternoon, Madam Elizabeth, and thank you for welcoming us to this webinar and telling us who is in the house. I reckon South Africa is also present, and I think the whole region is here, and I guess this is really good. So allow me to go straight to the webinar objectives. We have 3 objectives. And the first one is to highlight innovative ways in which nurses and midwives strengthen ASRH quality assurance mechanism through continuous support, supervision, and monitoring at all levels to provide adolescent-friendly SRH services. Number 2, share innovative ways in which nurses and midwives, as critical workforce, ensure the SRH services are delivered in ways that are responsive to specific needs, vulnerabilities, and desires of adolescents in both public and private facilities. And lastly, share the innovative ways of identifying and addressing infrastructure gaps in the provision of quality integrated adolescent-friendly SRH services. So ladies and gentlemen, this is the objectives. Allow me now to go on and introduce the team of our 3 panelists. And our first panelist is Dr. Ruth Elizabeth Omondi, who is a senior nurse midwife with a PhD in public health and a postgraduate diploma in health system strengthening. She's currently a senior lecturer at Jaramogi Oginga Odinga University of Science and Technology in Kenya. And Elizabeth has 10 years of experience in senior management position, both in government and in the NGO. Currently, Elizabeth is a technical advisor for nurturing care with one of the 4 regional blocks, and also a lead technical advisor in RAMCA, that is Reproductive, Maternal, Newborn, Child and Adolescent Health, Nutrition and WASH Program at USAID. So Elizabeth will be sharing with us in policy perspective on SRH. Our next panelist is Julia Wampi. Julia is a clinical nurse with 6 years of clinical experience, and Julia works in Botswana and she will be sharing with us the experiences around sexual and reproductive friendly health services which she gives. Currently running a youth-friendly clinic in Letekane Primary Hospital in Botswana. And lastly, we have Dr. Haminin Lita. Dr. Haminin Lita is an expert in adolescent sexual and reproductive health with many years' experience serving as a technical advisor in adolescent, youth, and sexual reproductive health services in Namibia. She served as a head of department in health policy and management in the School of Public Health, University of Namibia in 2016 to 2021. She is involved in teaching, research, and also publication of articles in peer-reviewed journals and conference proceedings. Through the University of Namibia, she has participated among many trainings and facilitations around adolescent and friendly health services, including STI research. And she's going to be sharing with us the perspective of how to mainstream adolescent and youth-friendly services on reproductive health in our teaching, both in pre- and postgraduate studies, so that we align it to health system strengthening. So allow me now to welcome our first panelist, and this is going to be 10 minutes of your presentation. And this is Dr. Elizabeth Omondi, who is going to be sharing with us around policy and service delivery on SRH. So Dr. Elizabeth, you have the floor.
Liz, you are muted. Liz, you are muted.
Sorry for that. Sorry for that. Welcome all nurses and midwives in this webinar, and good afternoon. One would ask him or herself, why adolescent sexual reproductive health now? Adolescents face significant barriers that undermine their sexual and reproductive health and rights. These include lack of access to sexual education and lack of access to sexual reproductive health services, consequently making them vulnerable to early initiation of sexual activity, unwanted pregnancy, unsafe abortion, sexually transmitted diseases, and HIV. Why nurses and midwives? Nurses and midwives are the frontline service provider, health service providers. Nurses and midwives are the largest unit of health workforce, and nurses and midwives are critical in provision of adolescent sexual reproductive health. As nurses and midwives, we need to reflect on our roles and responsibilities, as clearly stated in the Nurses Act and the Code of Ethics for Nurses. We need to appreciate the autonomy of nursing and midwifery and take that as an opportunity for us to execute the best for the adolescents. We need to be accountable and therefore actualize our mandate in response to provision of quality adolescent sexual reproductive health services. For us to achieve and reach the adolescents with services that they require, we have to understand the varied practice context. All of us from different countries work in different contexts, and we have to appreciate that the interventions may need to vary depending on the adolescent situation within your context. Let us appreciate that adolescents undergo a lot of experiences, especially affecting their lives, one of which may be the social determinants of adolescent health, which include their livelihoods, which include the poverty, the religion, the living conditions within which they live. We acknowledge that the nurse and the midwives have a potential and are capable of making it happen for the adolescents. And this is well articulated in the Acting on the Promise document, where every woman, every child needs to access the services. And nurses and midwives must commit to make it happen and to make a difference in the service provision. I'll talk about the policy perspective. Nurses and midwives need to strengthen advocacy and operational research for them to provide evidence-informed intervention. Nurses and midwives are placed in opportunities where they can leverage expertise from the stakeholders, civil society organizations, and private sectors. So in order to provide opportunities for adolescents, we must take advantage of the situation in which we work, the situation in which we interact, and the communities in which we serve. So nurses and midwives must purpose to align intervention across the health building blocks. And why do we say this? It is because nurses and midwives are the ones navigating across the health system. And in no place within the health system, you will find that there's no nurse, or you'll find that there's no midwives. Next slide. So for us to ensure that we provide quality services, we need to first acknowledge the fact that policies on adolescent sexual reproductive health exist, both regionally and locally. What is challenging is the implementation and operationalization of these policies. And this vary from country to country, as well as the scale of implementation. So as nurses and midwives and the position that we undertake in the health service delivery, we need to undertake a step to understand the policies that are available so that we align what we are any service that we are providing to these policies. Nurses being frontline workers need to understand the policy dynamics and the political situation within which we work in, and then deconstruct the policies and ensure that you deliver services aligned to these policies. These guidelines enhance our service delivery of quality adolescent sexual reproductive health. And we purpose to standardize the provision of services through informed by available legislations, policies, and guidelines. As nurses and midwives, next slide. Nurses and midwives, we must take cognizance of the available policies globally, regionally, and locally, some of which we have placed here: the Global Strategy for Women, Children, and Adolescent Health. We have the Global Standards for Quality Healthcare for the Adolescents, and we have a toolkit to guide us in delivery of this, the proposed interventions within these guidelines. So we need to accelerate action to purpose reach adolescents with sexual reproductive health services. Next slide. What is our experience in the programs in adolescent sexual reproductive health? As nurses and midwives, in responding to adolescent needs, we need to be innovative. We need to recognize the diversity of adolescent populations, and within areas that we work, we'll realize that all the needs are not similar, and all the interventions must therefore purpose to address the needs of adolescents, both at community level and at individual level. We need to ensure we create an enabling environment, and this can only happen if we have legislations, we have policies that are governing our service delivery to the adolescents. We need to identify as nurses what has worked and in what contents did this work for adoption and adaptation. And if we are keen in the presentations that we've had previously, There are those best practices that have been shared with the nurses in various platforms that we need to adopt or either adapt. It is important that we acknowledge that linking adolescent sexual reproductive health programs to livelihood intervention may yield more results, because again, we have to understand the way the adolescents interact within the communities in which they live. So nurses must purpose to understand the cultural and socio-cultural dynamics within the communities that they serve, and expanding the scale of proven high impact intervention so that we reach a high number of adolescents, including those in hard to reach areas. We need to purposely strengthen social accountability mechanism. What do I mean? We have adolescent peer groups, we have adolescent community groups, we have community strategy now across most of the communities where we work, or primary health care. We must see how we leverage these structures to reach out to adolescents and provide quality services. We must make the adolescents also be accountable for their own health and ask for services that are supposed to be meant for them. We have to regularly engage with adolescents in provision of service delivery and strengthen platforms for feedback mechanisms where adolescents can provide feedback on services that they're receiving for purposes of improving programming. Next slide. For us to succeed in service delivery and increasing access to sexual reproductive health, we must build trust with the adolescents. Trust is key because adolescents are a group that is usually very suspicious, very uncomfortable, unless they can see that the person they are confiding in is a trustworthy person. We must understand the communities we serve. What is their perception on SRH? What are they saying about the services we are providing to adolescents? Have a listening ear. Listen to adolescent voices, listen to the community voices, and model the intervention to suit their demand. We need to understand and manage our individual self-prejudices, and we need to shift the mindset. Once we understand ourselves, then we are able to work on within our internal feelings so that we purpose to deliver good services to the adolescents. We need to strengthen integration. Nurses and midwives work across all the service delivery platforms in healthcare system. So how do we integrate adolescent sexual reproductive health to ensure that in every encounter with an adolescent, the service we provide are enticing to the adolescent and they receive them positively for purposes of also attracting adolescents? Nurses and midwives need to purposely engage primary caregivers to discuss ASRH, as it has implication on adolescent sexual reproductive health. We must reach out to the communities. We must reach out to the primary caregivers and empower them with information on sexual reproductive health and win them so that we work towards ensuring that adolescents access these services. We need to establish and implement M&D frameworks with clear leadership, such that we are able as nurses, wherever we work, to review data periodically and look at whether we are serving the population that we have been tasked to serve, and most of the adolescents. When you review data, you'll be able to identify whether the adolescents are accessing the services, and you'll be able to restructure your services to reach the adolescents. Let us leverage community structures to cascade adolescent sexual reproductive health information. Next slide. What are the lessons that we have in improving access to quality services? The first one is we must strengthen multi-sectoral collaboration. We must ensure that we work with other sectors and other partners. The leadership within the nursing must purpose to execute transformative, performance-driven leadership so that they provide stewardship in a way that is strengthening capacity of young nurses to be able to deliver adolescent sexual reproductive health. And this must come with structured way of coordinating ASRH so that gaps are identified and addressed on time. We need to identify opportunities that are there to improve and increase reach. If we have outreaches or in-reaches, how do we also design them such that they are attractive to the adolescents? We have to uncover the disconnect between ASRH policy intention, implementation, and outcomes. And this can only happen if, as nurses and midwives, we purpose to understand the policies that are available, the guidelines, and the strategies. We must speak and have a united voice, as unity will enhance synergy and influence policy direction. And this can only happen if nurses together purpose to support strengthening adolescent sexual reproductive health. We must apply systems perspective, systems thinking to ensure we reach out to the adolescents. With the understanding of the ecosystem, we'll be able to tap onto the available resources for improving service delivery. Let's strengthen partnership and identify appropriate packages of SRH that are suitable within our context. As nurses and midwives, next slide, we are tasked with the responsibility, next slide, of ensuring that adolescents access services. In conclusion, I want to say that investing in the health of adolescents makes good sense, and addressing adolescent well-being requires a whole of society approach. If we neglect ASRH and we fail to invest, then we are jeopardizing investments and eroding the future quality and length of life, and escalate suffering, inequality, and social instabilities in our countries. Nurses and midwives, we are positioned to increase access to quality adolescent sexual reproductive health across all the service delivery platforms. As Hexacon, we say kudos for the support of scale-up of advanced adolescent sexual reproductive health information and services. So nurses and midwives, let us purpose to not to be part of the problem, but to be part of the solution. It is time for all of us, nurses and midwives, to join forces in concerted efforts to scale up prioritized packages that are friendly to adolescents. Thank you.
Thank you very much, Elizabeth, for a well-delivered presentation, which you have shared with us on policy in service delivery of adolescent and sexual reproductive health. We will move to the next presenter, and this is going to be Julia. So Julia, you have 10 minutes to share with us your presentation on strengthening service delivery in the context of SRH systems. You're welcome, Julia.
Thank you. Good day, ladies and gentlemen. I am Julie, perspective from a clinician working with the young people in youth-friendly clinic. Why are we talking about adolescent and youth sexual reproductive health services today? This is a group of people who are unique. They are experimenting, they are learning, they are still trying to find their way around life, relationships, and therefore they need our help in navigating life. Adolescent and youth sexual health services or youth-friendly services are initiatives or services provided to the young people aging 10 to 24 to meet their individual unique needs in the manner environment that will attract them and that will make sure that they come back to sustain the motivation to come back to utilize the health services we are providing. So we are nurses, midwives, doctors, and everyone involved in the provision of the healthcare services. What's different? We've been providing the services for so long. The difference is we are providing the services for the young people. We are catering to their unique needs. The young people are different and their unique needs makes a difference in how their livelihoods are going to be maintained. We are providing a comfortable space in the terms of the facility where we are seeing these young people should be comfortable to make them want to come back. The provider who is giving these services should be providing a comfortable face and attitude to the young people so that they will be able to take something from the conversation they'll be having with the provider. The services that we are providing, we try by all means to provide everything in one place. Don't toss them around. Don't send them from pillar to post. We providing a one-stop shop model. Provide everything in one place. You are going to do the assessment and you are going to manage and make sure when they leave the room, they have everything they need, not from the one room to the next, because that will make them tired, some, and probably leave before they complete. We are going to make sure that the services we provide are free from barriers that might limit them to access information and even services. We build confidence in the young people we meet so that we can encourage future health-seeking behaviors. That is different from what we've been providing when we are dealing with the adults. So what do we provide in our youth-friendly corners, in our youth-friendly clinics, or any stop where you are seeing the young people? The services we provide is the general consultation, like with the adults. We make sure we provide family planning at that corner where you are seeing your young people. You provide counseling on whatever matter the young person is bringing. You provide them with HIV testing. You provide them with the pamphlets and the education material so that they can continue learning even in your absence. And you make sure you provide comprehensive sexuality education to every individual coming to the facility, and it should be age appropriate from as young as 10 to those who are already in their 20s. And we make sure we refer them and we link them to the next service provider. Linking should mean when they leave the room, they already know where they are going and they're expected on the other side. You don't just write the referral and you send them on their way. Make sure they are expected and they know the way to where to reach the service provider you are referring them to. So for these services to be able to be provided in this manner, we should have a minimum package. A minimum package, we are going to provide information, we are going to screen and test and manage, then refer where you are lacking and link them to where they are supposed to go. This is a one-stop shop model that I'm talking about. The integrated services, we make sure everything they need is being done in the room and not sending from one room to the next. So we are talking about making our services comfortable and attractive to the young people so that they continue using our services. How should our facility be looking like so that the young people will feel this is the place for me to be? Firstly, when the place is attractive, it will attract them to come. So let's make it accessible. We're making it accessible by having a signpost, identifying where the clinic is, and having our clinic painted in nice colors that can attract the young people, maybe displaying messages outside our facility and even in the inside where they will be waiting. That way, they will still be learning even when they're still in the waiting area. The picture there is our clinic in Bunteng Youth Friendly Clinic. It has messages on the wall. So this environment, it's saying a young person can sit around and start learning whatever is on the wall while waiting for their turn to get inside. Let's have our area at a very comfortable space, not mixing with other population groups where they might limit them to be comfortable. Let's have it as a clean area where everyone won't be hesitant to stick around. Let's have a platform for feedback. Have a suggestion box at a corner so that they can comment on how the services are, on what they are looking forward to. That way, we are involving the young people in the services we're providing. They usually say nothing for us without us. How are we going to know if they are liking what we are providing? How are we going to know what they are lacking within our facility or within the services that we are providing? As when they have a suggestion box where they can place whatever suggestion they have, we'll be able to know. the next step in how to improve our services, on how to strengthen the services we are providing. From the facility, now we have an attractive facility painted in nice colors and everything is there. How are we going to make sure this place now is going to be comfortable? It's not that the infrastructure will provide the services. We need nurses and midwives. We need receptionists. We need doctors who will be able to make sure the young person stays and get the facility, get the services from this nice facility we have. So we should be trained on youth sexual reproductive health. We should be knowing on how to handle a young person. So when we have a trained personnel, it's already a goal, because we know we can maintain this young person coming to our facility, because we'll be having someone with the attitude that will be open to the young person coming through the door. We have person with non-judgmental. Whatever the young person is bringing, I talked about uniqueness. They'll be coming with their uniqueness. We should be open to whatever they are bringing and be able to help with an open mind. And make sure that you understand their uniqueness, the unique trends the young people are going through. Whatever is out there, it's your business to know what the young people are into, so that you'll be able to help them. Don't be surprised when they talk about something. Make sure you learn everything around the young people. Have job aids. The learners who are visual and those who can listen. When we have a job aid and you are teaching about a certain topic, you with the job aid around you is halfway home. When we have a model and you are talking about condom demonstration, others, they have never seen it. So when we are demonstrating, they'll be able to look at you doing it, and they can do a written demonstration. You'll be able to gauge how much they have acquired through the conversation you had and through their written demonstration. So posters, flip charts, and models make the education in our youth-friendly services much better. Be innovative and creative. Having the knowledge on what's trendy will make you an innovative and creative health provider. You can target what they like for you to deliver the message the way they like it. On Facebook, have a Facebook account where you post information about the conditions, about the management. That way, you know that on Facebook, they'll be able to get the information. In Botswana, our nurses are running youth-friendly clinics. We have someone on Facebook posting something about, posting information about the conditions. We are on the radios, we are on the television. That way, we are making sure the young people are getting information. Now we have this individual who is trained. We have the facility which will be able to accommodate the young person, and we are providing this package. In Botswana, we have those places are across Botswana, 37 clinics where we provide the youth-friendly services. And we have different levels of our facilities. We have those that are standalone facility, where there's a caravan or a quarter cabin or where youth-friendly services are provided within that facility. Or we have integrated facilities where within a bigger facility, within a bigger organization, we have a certain space labeled youth-friendly, where the young people know they can gather at a certain corner, gather at a certain tree to be able to access the services. And we have those that are running within our schools that have clinics, especially where we have borders. We make sure that we provide the services in that clinic youth-friendly, so that we can serve the population that is targeted. And all our facilities are run by those who are trained. And when we have someone who's new, this trained officer takes this one under the wing. Make sure we share information within ourselves to make sure that those who are not yet trained are getting information through peer-to-peer education, through in-service lectures. That way, we'll be able to empower each other. So on our next slide, we have some of our facilities that are across Botswana. a standalone facility, beautiful in Silibe Pikwe. That's where the young people are getting their services. That beautiful porta cabin, colorful. The young people are comfortable. They are just alone. We can have any conversation with the young people without them feeling judged by others around them. Be able to have conversation with their nurse there and getting the services within that room. On the other side, we have a youth corner. This is where I work. It's a room where young people are being seen. It is within a bigger establishment, but there's a door where the young people know within this door we'll be able to get our services. Despite having the adults and other population groups within the building, the young people are sure to be able to have their services in that corner. So make every space that we have comfortable enough. You are in maternity ward, make sure that the young person walking through the door is getting the services that are age appropriate. You have a 17-year-old who is a mom and a 35-year-old who is a mom. They are here at different level in their lives. So make sure you go to the level of each and every individual. It doesn't matter the environment as much as you can provide the best possible information to that young person who make a difference in the life of that young person. In our life, we have many aspects. The culture and the religion. That's another aspect that is very important when we are talking to the young people. The young people live within our communities. So the community influences young people very much. Now, when we're having these young people within a certain religion, within a certain culture, you should be able to meet them from their point of view. In most of our cultures, sex talk is a taboo, and the young people need information about sex and relationship. So collaboration with churches will make sure that the young people get information even within the churches. Our young people are in churches, and we don't talk about sex in churches. So as a health provider, when you want to meet these young people at their needs, you collaborate with churches, have meetings where you can address young people, educate them within their churches. Maybe they're not coming to your facility, educate them where they are so they can know where to find information and they will know where to find you to get the commodities you are selling to them. Within our cultural practices, we have other practices that might limit the young person coming. Engage our traditional leaders. Make them understand the importance of young people getting the information. When you have the traditional leaders on your side, you'll be able to reach to the young people within that culture without the others or the leaders trying to bring down the information you are sharing. Making sure they are with you in this, you'll be able to capture the young people who are within your care. Provide health education on issues in churches, at the playgrounds when the young people meet. So we are leaving the clinic and we are going outside, but we are still providing the information that is youth-friendly to our clientele. The facilities that don't provide contraceptives, like our faith-based facilities, they emphasize on abstinence. So when you are at a place you are not providing the commodities, make sure you give them information and you link them to where they can get the services that you are not providing. Your referral should not just be something written on the paper. Make sure you link these young people to the services that they need. So in conclusion, I would say, let us work together as healthcare providers, from someone at the gate to anyone who will be meeting these young people. Let's work together to raise a healthy young population. The young population is the biggest population group that we are having. And with them learning, we want them to learn the things that will make sure that they're going to be nurtured and be healthy as they go into the adulthood. Thank you very much, ladies and gentlemen.
Thank you very much, Julia. That was well articulated. And we appreciate you shared the experience of Botswana in terms of the service delivery point that should be youth-friendly and that will be able to attract and motivate young people to come and seek services. And I think one key point you brought out is it should be a one-stop shop. And if we are linking them to other services, it should be clear that by the time they leave these services, they know where they are going. Very well presented. So we move to our next presenter and the last panelist. And this is Dr. Hamin Letia from Namibia. And she's going to be sharing with us how, from an education perspective, our nurses and midwives should be prepared to be able to handle services that are focused to address adolescent and youth sexual reproductive health. So Dr. Hamin, 10 minutes for you to share with us what you have prepared. You're welcome.
Thank you, Fred, for the opportunity. Good day, every participant. As was mentioned, I'm going to share regarding the education and training of nurses and midwives so that they will make a contribution in the treatment and care of the adolescent and the youth. The expert opinion regarding as to what is expected from educational institutions regarding the education and training of nurses and midwives, as we were already informed and we are aware, nurses and midwives, they play an important role when it comes to the health care of adolescents. Therefore, it is very important for them to be well prepared to be able to deliver the services for when they are on duty. And now, what it means is the educational outcomes of the nursing preparation program should be planned in such a way that after they are coming out of the training, they should be able to put in practice, not only to understand, but also to put in practice and to bring out the results, what they have learned in the training. And this training should help nurses and midwives to be prepared to equip information also, not only to the adolescent, but also family members, as well as other stakeholders that are involved in the health and well-being of the adolescent. And this means we have also to consider stakeholders that are involved when the health rights of the adolescents are violated, because we may find, for instance, there are officials who deal with cases of rape. Yeah, it's one aspect of violation of human rights of adolescents, because when we are talking about adolescent sexual reproductive health, we should also consider their rights. And this is just one example. And as we know, some of the health issues surrounding adolescents, they happen because of inbuilt prejudice and injustice, as well as the effects of social determinants. Some may be at a vulnerable position where they find themselves in the community, or where they are having no lack of support nearby. And who is there to be able to strengthen these adolescents to come up and stand for their rights, and also to report, as well as to make the communities aware when they are violating the rights of the youth and adolescent. So the nurse and midwife should be in a position to implement this, and also to assess and find out when the situation requires actions from which partner, and they have to act as advocates. Next one. And as we see, this aspect of making sure that the educational outcomes are talking to the needs is in line with Sustainable Development Goal 4, that is talking about quality education. It's only if we are addressing that in our nurse and midwifery education, then we'll be able to respond to the needs of their adolescents. And what is happening currently, the trend is we should have inbuilt adolescent-friendly training in the basic professional education training of nurses and midwives so that we ensure they are ready by the time they take up the job. Also, there should be for in-service training to update through continuous development program, those that did not have a chance to have in-service training, or those that have been in service for a long time, then in-service training is for them. Also, research so that we reflect on our practices. So next one. The context of Namibia that we have to share. Namibia is a country in Southern Africa with a population of about 2 million, and we have 34 years of independence. And the United Nations Population Fund has noticed that Namibia is making progress in ensuring adolescent sexual reproductive health. Yeah, this is so because they have tried to address this in their national policies and guidelines. And then they also have adopted a multi-sectoral approach to address the needs of the adolescent and youth. The next one. This is not to say that we didn't also not have challenges. We have experienced challenges as well. And then from those challenges, our government has learned to deal with those challenges head on. All the stakeholders, they are taken up on board. These include now the effect on educational institutions so that everybody is talking the same language. It means our government has adopted that strategy to emphasize on human rights. And then that is also ensuring that everybody is following suit. Like the case of the University of Namibia, our adolescent-friendly health services, they are included in the pre-service training for the professional nurses and midwives so that they are prepared for the service. And one thing we have learned also through our government, our government denounced all the harmful practices that were picked. Nobody should be discriminating or forcing any violence to the adolescents and youth. That is not allowed in Namibia. And so that is our national flag. And for the sake of, I have to mention that we are mourning our third president. He was sitting, and he contributed a lot in emphasizing the development for all in collaboration with the UN partner, UNFPA and UNICEF, much emphasized in Namibia. And they are the key partners that work together with our Ministry of Health and Social Services, which is the stakeholder or the custodian of all the health programs, including this one of the adolescent and youth. So our president is late on the 4th of this month. He is still to be buried. May his soul rest in peace, Dr. Hage Godfrey Gonkob. So the next one. The slide that is on is to indicate that Namibia, in collaboration with the partners, we have noticed that, as was mentioned, some of the trainings, they don't need to be given by word of mouth, but by reaching out to the community, work with them, and teach them properly. And sometimes art and poems may be powerful in taking ahead the message to promote adolescent sexual reproductive health. And that is what the Minister of Health in Namibia and UNFPA have done to reach out to the parents and to the neighbors and all those are involved in the health and welfare of the adolescent. And what we are doing in Namibia, the University of Namibia has also adopted the same. Our nurses and midwives, when they are in their training, they are taught in class, but also they have time to practice in the field. This is inbuilt already in their curricula, so that they have a time to work with the nurses in the adolescent-friendly health services in the Ministry of Health. And they are practicing also to identify violence, like you have said. They work together with law enforcement people so that they know how to deal with these cases of youth and adolescents in case they are violated or in case they are deprived from access to services. So all the vulnerable youth are assisted in that way. So the aim for the University of Namibia and the training in Namibia in general is to ensure that when nurses and midwives are completing their training, they are already gone through the guidance so that they will be able to function properly. And community participation is what I will address or highlight from this slide, because it's where we have multi-sectoral approach. Our community leaders, church leaders, law enforcement, and also all the community organizations at household level, they are involved. And then, as I said, teamwork and assessment of vulnerability for the marginalized, especially because those are the ones that are likely to be deprived, to lack access, and also to lack information. And that is where we focus. So that is it from the perspective of the education institution and our case in Namibia. Thank you for listening.
Thank you very much. Thank you very much, Dr. Hamin, for taking us through the perspective of integrating SRH in training, both in pre-service, in-service, and also on the job training, and the aim that the University of Namibia emphasizes on in terms of empowering the nurse midwives who go through your program. Ladies and gentlemen, now that brings us to the end of our panelists' presentation, and I want just to pick up a few comments that are coming through. The question and answer dialogue is available for you to put across any question to the presenters so that they can pick it up and they'll be able to present. But before that, I want also to just assure you there has been a number of requests on the presentations, and I think Hexacon Secretariat will make every effort to make these slides available to those of us who are able to register. So the first comment is there anyone on this panel working on the support towards pregnant and parenting adolescents with diverse childhood experiences, or can I be linked with anyone I am researching in this area and I need some support. Please let me know if anyone can help. Thank you. Wairimu from Kenya. Dr. Patricia Watch from Kenya is asking and directed to Julie, what are the practical steps to ensure services for adolescents from Botswana? Are these services standalone clinics or they are solely government initiatives, or who owns or who runs them? So Julia, please take note of that. A good comment. I like the integration of religion. How did you incorporate the religious leaders that do not support this, I believe, SRH or youth-friendly services? This is from Jacinta Mtegero from Tanzania. Santos from Mauritius says, religion impact has such negative views about family planning services. It's an observation. Anne Madong from South Sudan, this is interesting. The idea of religion integration has a huge positive impact, but it is a start. It's challenging with our setting. I guess that is from a setting from South Sudan. There is a question that has been asked also to Julia. How do you see the respective advantage and challenges? And have you tried to make the service provider adolescent friendly at different levels of care? So at every point of care, the service providers are competent to provide not only SRH, but also adolescent youth health services. So those are questions that are coming through. I think directed to Dr. Hamin. One is an observation that it's important to include adolescent health into curriculum of nurses and midwives. It's an observation from Anne Madong from South Sudan. Integration of comprehensive sexuality education at both upper primary, secondary school level can play a pivotal role in curbing information gap on SRH. This is by Obulejo Stephen. So I want to invite Julia, Dr. Hamin. The two of you already, you have questions here that members have thrown. Julia, I hope you've taken note of the comments and the questions that have come through. I'll give you some 5 minutes just to respond and to clarify those points which have been raised so that members are responded to. Julia, take it on.
Sorry, just
thank you very much.
One clarification on the question on support towards pregnant and parenting adolescents with adverse childhood experiences. That was not from me. I was just sharing with the panelists. That came from Felicitas Bachika. Just for that clarification, for whoever will undertake that question. Thank you.
Okay, thank you.
Thank you very much. I wish we could be having a slide on our questions. I couldn't get the question when you were reading the question. You're a bit fast, and I can't find them from the chat. So I don't think I have.
Okay, let me read. Let me read again. I think the first question is from Dr. Patricia from Kenya, and she asks, are these clinics from your Botswana experience standalone clinics or are they government owned? So maybe you can be able to clarify that. And then number two, how are the religious leaders supporting the initiative? I think you hint the approach from Botswana, but perhaps you may want to just clarify further. I will stop at that so that you can respond.
All right. I thank you for the questions. In Botswana, all our youth-friendly clinics are the government. They are within our facilities, and it's our government. And I was talking to the experience of working within the government within a youth-friendly clinic. I hope I answered the question. With the religion, our leaders within the religious and the cultural environment that we have, they are not forthcoming. So it's our duty as service providers to make sure they understand. We have statistics, we have teenagers getting pregnant, we have substance use, we have mental health issues within the young people. Going to them, presenting your case to them will make sure that they understand. We are all working for the welfare of the community, both the religious, the cultural leaders, and us as the healthcare providers. So make sure you sell your services to them. Before you go to the community, go to these leaders, because their influence on the community is very massive. So going to them, making sure that they understand your point, and maybe sampling the education you are going to provide. When you're talking about comprehensive sexuality education, I know most leaders, cultural and religious, they're not what can I say? They don't like when you talk about sex. They say when you teach them sex early, they're going to experiment early. But we have the research that shows that those who are not educated about sexuality issues, they usually experiment early, sex debut is early, and they get pregnant because they didn't know what is happening and what can they use to avoid the pregnancies. So sell your services to them. That way they will buy into your services and they will support you in your service provision. Thank you.
Thank you, Julia. I guess that is really clear to both the participants who raised the question. I want to invite Dr. Hamin. I think there was a question on incorporating the curriculum. Maybe your comments, and then I will invite Dr. Elizabeth. From a policy perspective, there's a question asked by Santos Uyu Agor on how do we actively engage the religious leaders so that they are not stuck on what they believe in, which is natural methods of contraceptive, rather than, the modern, or better put, giving the young people the choice, the freedom to make a choice on what really works on them, in that order. So Dr. Hamin and then Dr. Elizabeth.
Thank you, Fred. I think that regarding integrating the adolescent-friendly health service training in the pre-service, that one, the University of Namibia has addressed already, because it requires the modules that the Ministry of Health and UNFPA have prepared. Then that one, we look at the module in the course that is fitting. Mostly, they are put in community health nursing and also in midwifery. They put the aspect of adolescent-friendly health services. And then the lecturers themselves are also the one that facilitates. And before the curriculum is designed in such a way that it's already included. And it's a consultative issues. The ministry and the NFPA, they also assist, but it can be done. Is what we are following. And then the second thing, there was a remark regarding integration of adolescent-friendly health services in the secondary education or something. Yeah, in the basic education in Namibia, we have also that are addressing life sciences and also life skills. But that is like a start to orientate the learners towards a good culture of respecting one another, and also to orientate them to how their body works, which are aspects of adolescent-friendly services. Yeah, but the complete care training is currently at the university education and also in service education from the ministry training centers. I hope that have addressed the comment, the concern.
Thank you, Dr. Hamin. Let me invite Dr. Elizabeth.
Thank you very much, Fred. In response to the question on how do we engage religious leaders, especially with regard to policy issues, I think the first thing that we appreciate is that religious leaders are gatekeepers and are very influential. So taking cognizant of that, then we need to empower them with information. And this information should first be, what policies do we have as a nation? What policies do we have as a region with regard to adolescent sexual reproductive health? Help them to understand these policies. Alongside that, help them to understand the data of these emerging adolescent issues, the ones of pregnancy, data on adolescent HIV infection, data on STIs among adolescents, and disaggregate this data up to the level of their operation, so that you are bringing it closer to them and showing them that this is what is happening. Now, within that, then let's have dialogue and see, because we have various methods of ensuring that adolescents are protected and are enabled to survive and thrive. So once you engage the leaders to the level of their understanding without having a lot of big jack on words or complications, then they are able to engage at that level and make decisions that are informed with information that is adequate. So sometimes their reaction is because they don't have information, and also letting them understand the context in which they operate and what is happening. There are mortalities as a result of adolescents not accessing these services. Adolescents are really dying. Let them know the morbidities that are there, and with that, then you are able to engage and help them to make informed decisions. Thank you.
Thank you very much, Elizabeth. I think I love the point of religious leaders being, gatekeepers and very influential of our values and practices in every societal setting, and I think that is really important. And maybe there seems to be a lot of question around issues of religious practices and issues of policy. I want to invite a few people maybe from across the participants that are here, just to share with us what the practice is in your countries. You can raise your hand from Tanzania. You can also raise your hand from South Sudan. I think South Sudan has been able to observe this. You can also raise your hand from, we have Zambia and we have Zimbabwe. If we have participants who are ready. Yes,
I see
yes.
January in Chimbi. Maybe you can go first, and then Lucana.
Good. Help me coordinate that.
And then, okay. January, do you want to go first? Good.
You tell us from which country? Very briefly, in 1 minute.
Or maybe
Next
January,
is
Lokana or Otsile or Otsil.
Yeah, Lucana. Unmute and speak from wherever you are. Tell us which country. Who is next?
Okay, then we go to Jacqueline Juma.
Jacqueline Juma, unmute and talk. People have challenges with speaking.
Yes.
We have about 5 minutes to bring this to an end, and I want just to run through a few comments that have been posted here.
Okay, let me just try. Let's try one more. Dangwa? Are you able to come off mute? Or Lucana? Yeah.
Technology.
We have so many hands.
Yeah,
Lucana or
unfortunately.
Helena, if you're able to speak or come off mute.
It would be nice to hear their voices and their comments.
Agnes Hassan? Don't be shy to come off mute.
Hello?
Yes, go ahead, Agnes.
Tell us from which country?
Yeah, I'm Agnes from Tanzania.
Proceed.
Just to say thank you for because you were in a hierarchy of these young girls, the way they are living to our country, wherever in the schools, in the colleges. So I thank you so much for this presentation, all presenters. Thank you.
Thank you, Agnes. That's very good compliment. Any other hand, Wairimu?
We still have the same from Lucana and Helena.
Who are not able to speak. Let me just read. We have a comment from Wendy Damini. That should be from Eswatini, from not wrong. How have you ensured that adolescent SRH is visible in your curricula? Is it a standalone course? I think that has been responded to. Emily Maringa from Kenya, I just want to know how the school clinics operate. Are they within the school compound? And which ages are able to access the comments from South Sudan? We have comment from, there's also, we comment on mental health among adolescents in your country. Dr. Christine Muse, is this directed to Julia? So that you can be able to combine the one of school clinics and also the status of mental health. So Julia, you have two questions, and then I think we bring this to a close.
Yes, I had the question on the school clinics. What's the other question?
Do you combine also mental health services integrated with the SRH?
All right, thank you. The question on the school clinics. These school clinics, yes, they're within the school premises. They cater for every student within that compound. So all ages within that school, no one can come from outside the school. Catered for, and sometimes the workers within the school can be seen in that clinic. So the ages are those students within the school. Usually it's teenagers, it's 14 to 21. We have those who are still at 21, but they're still students. So they are catered for within that clinic. We make sure that they don't have to go outside the school premises to get the health services. So we are bringing the services to them. Our youth-friendly clinics, we are integrating everything and we link to other services. So when we meet a young person who has issues with mental health, we start the conversation with the young person, start the consultation and link where you are not sure on how to manage. We link to the psychiatric clinic that is within the facility or which is nearest. And we do have the nurses running youth clinics that are psychiatric nurses. So if the clinic is having that nurse, it means that nurse will be seeing even the psych patients who are youth within the age group of 10 to 24. When we are not competent on giving the management for psych patients, you refer and make sure you link them to the relevant facilities. Basic counseling is being done within the clinic. If it's just something social, we can just talk about it in the clinic and provide the counseling.
Thank you, Julia, for responding to those questions. I think you have been able to answer. And now we are 1 minute past the hour, 16:32 minutes past the hour, 16:32. And I want just to hand over this to George so that he can be able to run us through the post-webinar and a closing remark. But before that, I want just to say that a big thank you to all of you. Many questions, many comments that are very positive that have come in. Our panelists, Elizabeth, Dr. Hamin and Julia, you've been able to share with us from the wealth of your knowledge, the experiences around training, policy, as well as what happens practically from the clinic service delivery point. And I think, Julia, your presentation has attracted too many questions and comments, meaning this is a really area of need. Ladies and gentlemen, as you saw, we're looking at this webinar in the perspective of health system strengthening, issues of leadership and governance, nurses in position of leadership, how we can be able to leverage. And I think Dr. Mondi brought this out very clearly, looking at the autonomy of nursing and midwifery practice and the code of ethics that we have that support us, policies from a global perspective, from regional perspective, as well as country-specific policies that we operate on, and then our own experiential knowledge, which Julia has been able to really bring this out very, very well, and the training, our dynamic training programs that are evolving to address the challenging times that we are in that are specific to young and adolescent youth. So from my end, I want to thank you for being very attentive and being orderly, and we look forward to engaging into the future as and when similar webinar is organized. So I want to hand this to George. George, take it over.
Thank you so much, Fred, for having led the session.
Wow, hold on.
Thank you so much, Fred, for having led this session. At this point, I want us to just interact briefly with some of the resources that we need to have to know about and need to put in use as health service providers. This is a must-use resource if you are in you're in the area of ASRH service provision. It is a must-use tool, and I just want to urge all of us who are in this space to be able to sign up for FP Insights, which is a resource tool that is powered by our project, Knowledge Success. And through this tool, you are able to use it to gain a lot of knowledge, build your capacity, get to know what's happening in space, learn more across colleagues. You are also able to even curate your own resources and put there. So I would really want to urge us as a team, as service providers within this space, to be able to sign up to www.fpinsight.org. Once you sign into that, you are able to be able to get access to the resources that are available within FP Insight, but above all, you are also able to be in a space where you are able to quickly find relevant information around FP-RH, but also ASRH, and also in any other area that you want to know with regards to FP-RH. So this is a reminder. We always do it as a reminder in each and every webinar that we are having in this space, so that you sign up to www.fpinsight.org. And I believe that you are able to sign in if you have not signed in. If you have not signed in, please continue doing the good work in terms of curating resources, learning from each other across what is happening, what is trending with regards to FP-RH program. So that's a polite reminder to us to be able to log into FP Insight website to be able to continue to build ourselves as FP-RH professional, because it's a place where we save all our resources that we can discover and get inspired with the good work that we are doing. I'll move to the next phase of our time. So we are going to carry out a poll, a quick one on just how this went. So as we are waiting for the poll to come up, the poll should be able to be up in a moment. Yes, there we are. So number one is, overall, how would you rate the quality of this webinar? Was it excellent? Was it very good? Was it good? Was it fair? Was it poor? We would want to know so that we are able to improve on our next webinar, because we are having series of webinars. So we want to know overall, how would you rate the quality of this webinar? Was it excellent? Was it very good? Was it good? Was it fair? Was it poor? It's important for us to know. Number two, how well did the webinar meet your expectation? How well did the webinar meet your expectation? A lot better than you expected, better than you expected, about what you expected? Did it leave you at a worse place than you were before you joined? Number three, was the webinar too long, too short, or about right? Far too long, about right? We need to know so that we also moderate on our time. Number four, how helpful was the content presented at this webinar? Was it extremely helpful? Was it very helpful? Was it somehow helpful? Was it not so helpful? We'd want to know so that we improve on our next webinar. Number five, how engaging were the speakers at this webinar? Were they extremely engaging? Were they very engaging? Were they somewhat engaging? Not so engaging? You'd want to know that too. Number six, how could future webinars be improved? You can select that applies. Should we make the webinar more interactive? Have more knowledgeable speakers? Use better technology? Address relevant topic and others? How likely are you to share the webinar recording with colleagues, clients, or friends? We'd want to know this, because we would appreciate if this discussion continues beyond this. So we'd really love to know that. Are you extremely likely? Are you very likely? Are you somewhat likely? What webinar topics do you like in the future? Do you have any other comments or questions that you'd want to? Do you have any other comments, questions, or suggestions? We'd love to know that, so that we use that to improve our next webinar. Love that to improve our next webinar. Come on, good guys, participate. participate. We are only having 40 responses out of above 130 of us. So we really appreciate to get, if you can get as much as over 50, over 80, over 100 responses to this. Let's get the responses coming. It's important to improve on the quality of our next series that is coming. Okay, we are at 40%. And we've done slightly more than 3 minutes. So I believe we've had, oh, wow. Keep them coming, guys. We are at 54 out of 123. We are 55 out of 123. Keep your comments coming. This is very important for us because it's going to help us improve on the quality of the next series that we are planning to have. Okay. So we are slightly above half. So I think we will be able to end our poll now. And move to the next. So at this point, I would want to call Lemi from Hexacon. Not Lemi, but if Madam Elizabeth, if you're still there, then you'll be able to give vote of thanks. And then we'll be able to conclude. But just before Madam Elizabeth comes, I would just want to give a shout out on what to look for. Please look out for these coming conversations in terms of the webinar series that we are looking at. There's a comment about mental health, and sure, we had that in mind. So we hope to have a webinar. Our next series of webinar will be focusing on mental health to nurse practitioners. And then subsequently, we'll be able to deal with integrating mental health into MCH and SRH. So be rest assured that and keep locked for this, because the next 2 series will be very exciting because they're dealing with issues mental health for us as service providers, but also on our clientele who are adolescents. So I would invite Madam Elizabeth to come and give a vote of thanks on behalf of Hexacon.
Thank you very much, George, for this opportunity to just say thank you so much, everyone, for attending. This has been very successful from where I sit. We were so many at one point, we were more than 170, and I think the quest for education is really, really high. So we want to thank Hexacon Secretariat, we want to thank Amref for organizing this. At the end of the day, we were 21 countries. Almost all our countries from the Hexa region were there. But we also had Egypt from the north. We had Nepal outside Africa. We had Burundi, who are not yet part of Hexa. And we had Mali. So we want to really thank you so much for joining us. And we hope to see you again next time. Let me take this opportunity to also congratulate our very able moderator. It's done extremely well. Thank you so much, Fred, for being there for us. I also want to thank the facilitators, the panelists. They were extremely, extremely useful. And the choice was excellent, so that we have someone from practice, another one from policy, and then we have education. That mix made all the differences. And as George has said, there are many, many questions about youth-friendly services. And that tells us that in our countries, perhaps we need to invest in such services, that our adolescents can benefit from such services. So again, I thank everyone who came, everyone who has stayed to the end. God bless you and God keep you. Thank you. Over to you, George.
Thank you so much, Elizabeth. And on behalf of myself and our team at Amref and Knowledge Success, we are very grateful for your participation. We look forward to the next webinar series. And also on behalf of the panelists, the able panelists and the moderator that we had today, we are very grateful and looking forward to engage you in the next series of webinars. Thank you so much and have a blessed evening.
Thank you, George.
Thank you all.